Happy Monday. Turn to your neighbor, say Happy Monday. All right. Glad you all are here. I'm Dr. Yachter, if we haven't met, so welcome. Everybody all recovered and ready for normal life again? Yeah? Okay. And I just wanted to welcome the guests. Raise your hand if you're a guest here tonight. Raise your hand if you're a guest. Please, put them up high. Wave it in the air like you just don't care. There you go. We have a special guest in the house, Mrs. Dalen. It's her birthday today. Everybody let's sing happy birthday. Happy birthday to you. Happy birthday to you. Happy birthday, Mrs. Dalen. Happy birthday to you. Woo-hoo. All right. We won't ask how old you are because we know that you're going to start getting younger after this workshop tonight. So, how many of you guys have been to a workshop before? Raise your hand and say, good, okay. And how many of you have been to 5 or 10 workshops? Keep your hands up. About 20 or 30 or more workshops, keep your hands up. 30, 40, 50, okay. Just, I like to do a little funny just so you get an idea and see why we do these workshops, how long we've been doing these workshops, and you'll see that once you come to one of the workshops, it's like a Pringles potato chip. You just can't stop eating. And when you stop learning, you stop growing, and when you stop growing, you start what? You start dying. So we've been doing these workshops for 17, 18 years now, every single month, and without fail. And we're always learning, we're always growing, myself included. So tonight is another chapter in our quest for constant and never-ending improvement. How many of you guys like to improve? How many of you guys want this year to be your healthiest year ever? Say aye.
Aye.
Okay, so let's dig right in. Make sure you have a workshop card. If you don't have one of these, have you guys seen these workshop cards? On the front and the back. On the back it has all the months and all the titles, like Heart Smart is September, next month is Cancer Prevention. If you come to 6 or more workshops and you're a patient, you get up to 10% off of your maintenance or wellness plan. So keep track of these. We'll keep track with you. And just make sure that you see what's on the agenda and you attend several of these because it will make a difference in your life and your health. Next one's coming up October 16th. This will be a life-changing event, I promise you that. Let's jump right into it. Statistically speaking, I don't know if you're aware of this or not, but heart disease is the #1 disease killer in the United States. It's almost 1 million lives lost annually. If you didn't know that, one person every 33 seconds loses their lives to heart disease. Women, listen up. 6 times more women die every year from heart attacks than from what? Breast cancer. Did you know that? Probably not. Under 50, women's heart attacks are twice as likely to be fatal as for a man having a heart attack. So this is serious, serious stuff. And right now there are 3 times more people dying of heart disease than in the 1930s. So that's interesting, isn't it? So compared to the 1930s, do we have less technology or more technology? Yeah. We have advances, we have access to the world's greatest technology and treatments, and yet we're still having more disease than ever, more people dying from disease than ever. And there's a reason why. So tonight, my hope is that you start asking yourself some questions and maybe even having many of those questions answered before you leave tonight, because it could mean the difference between life and death, and often does. Let me talk about cholesterol first. And there's 2 things that I want you to leave here knowing. That number 1, lowering cholesterol or your cholesterol, trying to get it down to very low levels, does not necessarily reduce your risk of heart disease or heart attack. And the second thing is that a lot of studies are showing now that reducing your cholesterol levels too low will cause many other diseases to develop. And so this is what we need to be aware of, because we've been conditioned to think, well, the cholesterol is bad. And that's not the case. I'm here to tell you tonight that what you're going to learn is cholesterol is not bad. It's absolutely necessary. So I want you to be a very smart consumer, and the next time that you meet with your medical doctor and they want to give you a prescription drug, or they tell you that you need to do this, this, or this, otherwise you could die, or this could happen, and they put the fear of God into you, I want you to have knowledge to back up the decisions that you make, and just don't be swayed based on somebody's opinion or fear. You're not supposed to do that. The more information that you have, the better armed you are to make the decisions that will keep you out of harm's way. Because very often people make decisions based on what their doctors tell them without thinking or without doing research, and they wind up in worse shape than if they did nothing to begin with. Does that make sense? So let's look at some facts about cholesterol. The brain holds 2% of the body's mass, but contains what percent of all the body's cholesterol? 25% of all the cholesterol in your body is where? In your brain. So it would seem that God didn't really make any mistakes. You know, He made you with your brain made up, a quarter of the brain is actually made up of cholesterol. So if you understand that that's normal for your body, then that would be a good place to start asking ourselves, well, why do we want to start reducing cholesterol? Cholesterol forms membranes surrounding the cells and keeps the membranes permeable. And permeable means that stuff can pass in and out of the cells, like nutrients need to get in, right? That sounds like a good idea, right? And toxins need to get out. And if the membrane is not functional and not permeable, we've got problems. And that's all based on cholesterol. So we need that cholesterol for that function. Cholesterol in the brain serves as a powerful antioxidant. It protects the brain against damaging effects of free radicals, which prevents cancer and aging. Okay, so let me ask you a question. What happens to all these benefits as a result of lowering your cholesterol? You get older a lot faster, and your risk for cancer, what? Goes up significantly. So that's why many studies are showing that the lower your cholesterol, the shorter your lifespan. National Cancer Institute did a study of 12,500 men and women, found the men with the lowest cholesterol were the most likely to get what? Cancer. Another study, European Heart Journal showed 11,500 patients found that those with cholesterol below 160 were more than twice as likely to die than those with high cholesterol. That's interesting, isn't it? That's kind of like the opposite of what we thought. We thought the lower our cholesterol, the better off we'd be. I mean, if that's what the doctors are recommending, then can't be all that bad, right? Statins decrease brain function. Here's how this works. This is important for you to understand, because neurons in your brain rely on the delivery of what? Cholesterol. Yeah. Via a specific carrier protein, which is known as LDL. Raise your hand if you've heard of LDL before. LDL. Is that the good or the bad cholesterol? Bad cholesterol, right? Well, here's what I'm teaching you right now. The LDL is not cholesterol. It's a transport mechanism. It's a transport mechanism which takes cholesterol to the brain so that the neurons can work. What do neurons do? They actually make your brain work. So you could think, you could reason. You know who people are. You can remember things. Without cholesterol, you can't do that. The neurons don't fire. LDL is the transportation mechanism. Did you know that? No. Yeah. Fundamental role of LDL in the brain is to capture life-giving cholesterol and transport it to the neuron where it performs critically important functions. So that's why this came out in one of the greatest and most prevalent and largest heart trial study follow-ups that they ever did. The original study was done in the 1950s and 60s, and then they did a follow-up study in 2005 in Boston University. And they did it with 1,900 participants. What they found was, they tested them with things like cognitive testing, such as memory, learning, concept formation, concentration, all the things that they would test people with Alzheimer's for. And they found that the people whose cholesterol was less than 200 performed less well on these tests. And the people who had the highest cholesterol levels scored the what? Scored the highest. Yeah. These are independent studies, not funded by drug companies, that's for sure. Here's another study published in journal Movement Disorders back in 2008 regarding Parkinson's disease and the correlation with cholesterol. They found that people with the lowest cholesterol, the lowest LDL cholesterol, were at risk by Parkinson's disease by what? 350%. Okay. So is there really such a thing as dangerously high cholesterol? Like how high can your cholesterol go without it becoming dangerous? 300 level cholesterol? Like if your cholesterol was 400, would you freak out? Of course you would. We would, yeah. So, but what's the basis for that? What happens if your cholesterol goes that high? Is it dangerous in fact? And where do we get that from? Well, cholesterol in and of itself is a very poor predictor of heart attack. The idea that aggressively lowering cholesterol levels with medication dramatically reduces your risk of heart attack That's already been refuted, categorically refuted, and there's no evidence to back that up at all. The Journal of the American Medical Association in 1994 published a study with 1,000 participants from Yale University. And the results of the study showed that people with low cholesterol have just as many heart attacks as those with what? High cholesterol. Doesn't matter, either way. It doesn't matter what cholesterol is high or low. The cause of heart disease is an independent factor relative to cholesterol. 75% of patients hospitalized with a heart attack have cholesterol levels in the what? Oh yeah, what's your name? Wayne, I'm Dr. Yachter, welcome. What's your name?
Hi, Doctor. I'm Karen.
Karen. Everybody, Wayne and Karen, welcome.
Oh, it took us an hour and 15 minutes to get.
But you made it. You made it. I promise you it'll be worth your while. I love when that happens. Every once in a while we'll get that. So what did that say? Did you get that? 75% of patients hospitalized with a heart attack have what? Normal cholesterol. So how does that happen? You know, how do you have a heart attack when your cholesterol is normal? Well, in fact, a lot of these people who have the heart attacks, they're on cholesterol medication and they're on blood pressure medication. They still have heart attacks. And what you're going to learn tonight is there's another cause for heart disease. There's another reason that you would have a heart attack or coronary artery disease, and it has little or nothing to do with cholesterol. New England Journal of Medicine published this in 2005. And they found that patients with low HSCRP, raise your hand if you heard of HSCRP, you know what that is. That's an inflammatory marker in your blood work. So whenever you get a blood test, that's what you need to look for. If your doctor circles the cholesterol and they say it's really high, we need to put you on a statin drug, say, gee doc, that's interesting, but what does my HSCRP show, my inflammatory marker? Because that's what the medical studies show from your medical journals shows the indication of whether or not I have a heart attack that's imminent or not. So that's what they found. The people at low HSCRP, the inflammatory levels, had fewer heart attacks no matter what their LDL cholesterol was, and they had more heart attacks if that level was elevated, regardless of their LDL cholesterol level. So these are the risk categories. You know, if you're over 3 milligrams per liter, you're at a high risk for a heart attack. And it doesn't matter if you're on a statin drug and your cholesterol is under 200 or under 180. Doesn't matter if they say that they have your cholesterol under control and you're on a statin medication. If that's what those numbers look like, you're at more of a risk for a heart attack than somebody who has no inflammation and their cholesterol is at 400. Got that? Does that make sense? Yeah. That's the number that we have to be concerned with. And so once we understand what causes a heart attack, which is what? Inflammation. Which is what? Inflammation. Then we look to correct the cause of that. Now we can start here talking about what causes inflammation, what triggers that, such as the foods that you eat or the stress that you're under and things of that nature. Because if you do that, then you can have peace knowing that, hey, you know, if you're one of those people thinking, you know what, I don't want to take that cholesterol medication. I don't like taking medications, but I'm scared out of my wits of getting a heart attack. Now you have no reason to substantiate that fear of having a heart attack, knowing that you're doing the right things. Low T. How many of you guys have seen that commercial, or you know people on Viagra, or they take Viagra, or they get testosterone shots? Why? You know, we never really heard about this. Many years ago, 20, 30 years ago, did you ever hear about low T? You see it on the billboards or the commercials on TV? Well, you look at, you know, all the medications that people are taking, and it interferes with normal hormonal production and regulation. And one of the things that does that, notoriously, is statin medications. Because cholesterol is a precursor for all hormonal production. Testosterone and estrogen. So when you strip cholesterol, when you take the statin medication or cholesterol-lowering medication, you're stopping the body from making the required amount of hormones that individual needs. So one of the most frequent things that we hear among people taking statins is decreased libido. Lab reports repeatedly show that people who are taking statin medications are twice as likely to have low testosterone levels. And so when you go to the doctor, they'll diagnose that effect, and Now you have another disease, and what do you get after that? You get another drug. But they'll keep you on their cholesterol medications, and that's frequently referred to as the medical merry-go-round. So there's a pill for every ill, and we create diseases from the side effects of a lot of the medications that we're taking. And it's an interesting concept. I don't know if you've ever asked yourself this: what's more dangerous? What's more deadly? The disease or the medication that they're giving you to treat it for? When you start looking at all the side effects of all these medications, you have to stop and ask yourself, is it really worth living your life in fear when the side effects of many of these prescription drugs will kill you faster than for the disease they give it to you for in the first place? So when you have a proactive strategy, something that you can apply to your lifestyle, and you start taking action, then you can let go of the fear and the bondage and the shackles of not being able to move away from this stuff. And that's what I'm here to help you with, to give you the encouragement. I'm not here to tell you to stop taking your medications. What I am here to tell you is that if you're concerned about this and you're asking yourself, well, I don't like that, what can I do instead? I'll show you what to do instead. And once you start engaging in all those things and you give your body the strength it needs to create health from within, which pharmaceuticals cannot do, then you can eventually start weaning yourself off and transitioning. Does that not make sense? It's common sense, yeah. Cardiac drug side effects. A lot of you, my patients, many of you sitting here tonight, and I've told you because I invited you to the workshop because I saw this in your profile while I was making this PowerPoint. Cardizem, Procardia, Tyzac, Norvasc. Some of you guys are on these calcium channel blockers. Causes a 26% increased risk of having a heart attack. Make matters worse, it causes brain shrinkage. The brain shrinks away from the skull. That comes from the archives of internal medicine. This is well known. 40% increased risk of diabetes with women who take statin medications. Again, these are medical journals. Were you aware of that? No. You're 48% more likely to become diabetic if you're taking statin medications. And then once you become diabetic, what do they give you for that? They give you diabetes meds. And this is a common diabetes medication. They'll give you metformin, which can actually increase your chance of dying from a heart problem by what? 250%. Hello? Can somebody let me out? Let me out of this madness here. This just does not make sense. It would make sense for people who are hopeless, helpless, who've given up, thrown in the towel, and just really don't care. Just throw the kitchen sink at me. I don't care. I'm your lab rat. I don't care. Do whatever you want with me. But those are far and few between. Most people are highly intelligent folks like yourself who can see the forest for the trees. And this is madness. There is a time and a place for medication to save people's lives and get things under control, but it's not designed for you to stay on for the rest of your life. It takes years off of your life and life out of your years. Right or right? Blood pressure medications, again, and I'm talking to those of you who are on this right now. Lipressor, lisinopril, atenolol, toprol, causes chest pain, shortness of breath, depression. Many of you have these symptoms. It's amazing. People come into my office and they have these symptoms. Memory problems, decreased sex drive, impotence, fatigue, insomnia, anxiety. Some of the most common things that I see: fatigue, insomnia, anxiety. It's almost like probably half the people that come in, aside of their neck and their back pain, they've got this. And what do you think is in their profile in terms of their medications? There you go. And so we're trying to help you with one thing. We're trying to help you get a quality of life. But how do you do that when you've got this cocktail of pharmaceuticals coursing through your body, causing you to have some of these issues going on? So while we're on the subject of blood pressure, understand that your body weight is a significant factor in your blood pressure levels. You guys all know that, right? Yeah. If you lose 10 pounds, what does that do for you? It doubles your chances of normalizing your blood pressure. How many of you guys know that you could lose 10 pounds if you wanted to? Yeah. If you wanted to. Yeah. Is there anything that you can't do if you really wanted it? Okay, so there's no excuses here because I know that I could help you. You just take the hand and let me show you the way. A 22-pound weight loss reduces your risk of heart attack by what? 75%. So I'm going to give you everything that you need here tonight to do this, if you'd like. It's very, very simple. When you start feeding your body what it needs, it just kind of lets that extra weight go. We're going to get to that in just a couple of minutes also. Normal blood pressure, I've heard this said before by many medical doctors and experts, so to speak, and they said that your systolic blood pressure, as you get older, it's usually 100 plus your age, still acceptable within normal means. And then I happened across this from the Mayo Clinic. They said if you're a healthy adult, age 60 or older, your treatment goal is less than what? 150 over 90. How many of you know people who freak out if their blood pressure is like 135 over 90? 140 over 90, right? Yeah. And God forbid, because then obviously you better be on a medication or you could have a stroke. And here, we're listening to the Mayo Clinic. Go online, guys. You can access any of this online. Do your Google search. You'll find the same thing. They've made changes to the recommendations as of late, and they've moved it higher. It's still within normal limits if it's 150 over 90. Wow. It's still within normal limits if it's 150 over 90. Remember, your systolic, it's okay for it to be your age plus 100 because your body is adapting to its environment. Blood pressure changes, it fluctuates. Did we not have a stressful last couple of weeks? Yes or yes? Would it not be acceptable for your blood pressure to be higher over the last couple of weeks than normal? Yes. If you went to the hospital under these conditions and they checked your blood pressure, would there be an increased likelihood that you'd probably leave with a prescription? Yes or yes? Yeah. If you were doing exercise, if you were on a treadmill, would your blood pressure be 120 over 80? Probably not. No. Okay. If I got you all up right now and we did some burst training, no, your blood pressure is going to go higher. If you're under stress, your blood pressure goes up. If there are changes physiologically in your body, your blood pressure goes up to adapt to that and accommodate that. There's an adaptative process that your blood pressure utilizes to enable you to survive. It's a survival mechanism. Okay? Now, frequently that occurs, as you get older because the blood vessels are not as elastic and they don't expand or contract. They're a little more rigid. And sometimes the heart muscle cannot contract as vigorously because you're not exercising as much. And in order to get the nutrients and the oxygen to the distal parts of the body, it needs to raise the blood pressure. Doesn't that make sense? Yes. No. So these are all things that your doctor doesn't usually discuss with you or think about. They don't really have time. They're taking your co-payment and shooing you out of the office as quickly as possible because it makes economic sense. But it doesn't make good, healthy sense for you. So we need to take this. These are, again, I'm not picking on any doctors. I'm just saying that this is our healthcare system, and it's designed to be a cookie cutter type of thing, and everybody's different. So what about cholesterol and coronary artery disease? What does that really have to do with, how has cholesterol become dangerous in your body? Does it become dangerous in your body, and how does that happen? Well, LDL can become modified by this process called oxidation. And how does it become oxidized or damaged? By what? Sugar. So sugar attaches itself to the cholesterol molecule and renders it nearly useless, oxidizes it, causes more free radical damage, which increases your risk of cancer, and drives something called what? Inflammation. So what is at the root cause of inflammation? Sugar, yeah. So that's what can transform LDL and take something good and make it bad. It's not that cholesterol in and of itself is bad. It's not, but it can be made bad by what you put into your body to aggravate it or contaminate it or exacerbate it. Does that make sense? Okay, so now you know the root cause of literally not just cholesterol, but every degenerative disease that you'll ever be medicated for or die early from. It all comes down to inflammation, which is all triggered by sugar, toxins, and bad fats. Sugar, toxins, and bad fats. And that's what we're going to dig into a little bit here for you right now. So when we look at the dissection of an artery, you could see let's say this is a coronary artery, and you could see that if you cut it in half and you look straight through it, it's fat and wide open, right? That's a person that has no clogging of the arteries. They should have normal blood pressure, normal cholesterol. But then this is a person that's having a lot of what? Sugar, maybe trans fats. Maybe they don't have enough good fats in their body to counteract the inflammation. So this inflammation starts running rampant. And this is a person, let's say for example, who's on a statin drug. Maybe they're on cholesterol medication, which is not reducing the inflammation, it's just reducing their cholesterol levels. So they continue to pummel their body with sugar, bad fats, trans fats, and things like that, drives inflammation, and what is it doing to the artery? It's what? It's closing it shut, but they have normal cholesterol. Finally, it gets to the point where it totally occludes all the blood going to the heart, and then their cholesterol is still in normal range because they're on a medication. What happens to this person if the heart muscle can't get the blood? They have a what? Does that make sense?
Yes.
Okay. That's why, again, independently, inflammation is different from cholesterol. And so we have to look at the cause of the inflammation. Peter Ahrens, a Rockefeller University researcher, this was done in 1955. This is what led into being part of the Framingham study, the heart trial study. He said the percentage of fat in the blood rises with the quantity of what? Carbohydrates. The fat in your blood is driven by what? Carbohydrates. Because what does that drive? Inflammation. And that's what's oxidized rather than the fat administered. And what he was saying is that the fat in your blood doesn't go up because of the fat in the food that you eat. The fat in your blood goes up because of the carbohydrates. That's interesting, isn't it? But I never thought that. So this is what we have to look to reduce and eliminate: sugar, bad fats, and low-fat diet. What you're going to learn is the good fats actually help to counteract inflammation. And what was the recommendation starting back in the early 80s? That we had a high carbohydrate and a what? Low-fat diet. So when they really started going on a public campaign with that was the mid-90s, around 1994. And as soon as they did that, in a couple of months, I'm going to have my diabetes workshop. I'm going to show you the statistical chart on it. It's like a hockey stick. It goes right up. So literally, the cases of diabetes doubled or tripled, like right after that happened, from 1996 to like 99. It just went straight up, just like that. And it's the same thing happened with heart disease over that period of time. So this is what we have to take stock of if you want to reduce your risk of heart disease, because this is what's going to kill the cause of it. And we have to look at the labels that we're eating, whatever the label is. It doesn't matter if it's orange juice or Pop-Tarts or fruit bars or maybe it's your spaghetti, maybe it's bread, whatever it is. You need to look at total carbohydrates and then the number of sugars. And if you see the total number of carbohydrates is coming from the total number of sugars, you got a problem. It's almost 100% sugar. In this case, it is 100% sugar. So what we've got here is maybe something that's confusing. Like, I thought orange juice was healthy, right? How many of you guys believe that orange juice is healthy? Well, it might be if you freshly squeeze it, right? If you squeeze it down, but you can't just squeeze one orange and drink it. A glass of orange juice doesn't work that well. How many oranges do you have to squeeze to get a glass of orange juice? Probably about 8, 9, 10. But does that sound like, how many of you guys have ever sat down and ate 10 oranges in one sitting? No. Too much of a good thing is not a good thing. And that's what this is. This is concentrated sugar, pasteurized, homogenized. They do all these chemical processes to it and, defile it in the process. In addition to that, having a lot of sugar. So I don't need to go into like the soda and all this stuff. You guys know. And of course, all these you really know. But what people know less about is what lurks behind the label, like the high fructose corn syrup in a lot of these. The freshly baked breads have trans fats and hydrogenated oils, and sometimes corn syrup in them. Go over to Publix, read the label. The bakery baked it there freshly, and if you read the label, you'll be astounded at how many chemicals. There's like some of these breads, the bakery breads, 60 or 80 ingredients in them. Many of them you can't pronounce. So what does that tell you? There's chemicals. There's all kinds of chemicals in them. And that's what drives inflammation, guys. If it was made in a laboratory, it's going to drive inflammation. It's not good for you. So that's just what we have to remember. Now, when we look at rice, when we look at grains, there's varying levels of these. Really the worst of it is the white pasta, the white bread, potatoes. The problem with this is it causes insulin to go up. And when insulin goes up, when you have an insulin response, not only does it burn your pancreas out and predispose you to diabetes, but it also causes fat storage. It's going to make it hard for you to keep the weight off. And it's going to cause your blood sugar to go up. Your A1C is going to run high. Before you know it, you're going to become diabetic. And remember what the quote that I just gave you from Peter Ahrens at the Rockefeller University: as the quantity of carbohydrates goes up, what else goes up in the bloodstream? The fat, right? Your triglycerides, your lipids are all going to go up from this. So rice in and of itself, maybe like basmati, jasmine rice, good rice. It's good. These are good carbohydrates. The problem is if you're a heart patient or a diabetic patient, you just want to eliminate this and give your body a chance to heal. Now, after that happens, then you can start adding some of that back in, right? Does that make sense? But until you have healing and you could see, the scale go down and your blood pressure coming down and your blood sugar coming down, until you see those results, I wouldn't add any of this in. I would just go with proteins, fruits, and vegetables. That's it. So this is really, what you should look for to eliminate in the beginning, because many of you are here because we've had this discussion. You want to reduce or get off some of the medications, you want to lose weight. I'm giving you the easy way out. And I hate to say it's easy because it really is. If you just eliminate this, your body will unload the unwanted pounds. So why is it hard? Because that's what's in your closet right now. Why is it hard? Because that's the habit that you're in right now. Why is it hard? Because that's what's on the menu. Those are the drive-thrus that you're used to going to. That's what's in your pantry. That's what your wife or your husband is used to making for you. And you have to stand guard, and you have to be, the bodyguard, so to speak, of your health. So it just requires some investigating and some research. So you go home, you get on the internet, and you go on Amazon, and you look for little recipe books, like an easy one, like Paleo for Dummies. I'm not calling you a dummy. I'm not calling you a dummy, but it's a great book, Paleo for Dummies. Go research the paleo diet. I mean, that's the easiest thing that you can do because it's proteins, fruits, vegetables, good fats, grass-fed meats, and there you have. You'll have all the recipes that you need, and without getting creative, just know to cut out all the grains. Just cut out all the grains. Once we start seeing results, you can start gradually adding some back in. So that's what it looks like. All these things. You love the bread. I gotta have my bread. Oh, I gotta have my bread. Doc, you don't understand. I gotta have my bread. No, I do understand. I understand the stuff tastes good. Believe me. And you'll have your cheat days. You will. I promise you, you'll have your cheat days. But, in the beginning, when this goes off and you start, sticking to it after a day, 2, 3 days, you really lose the cravings for sugar. You really lose the cravings for all this stuff. So that's what it is. Sugar's an addiction. The same chemical reaction that you have to sugar or bread or any of these carbohydrates chemically in your brain mimics the hit that people get from cocaine or heroin. It's the same exact thing. When they take MRIs of people's brains and they show the chemical reaction, the endorphins, the part of the brain that lights up, it's no different from sugar or recreational drugs. Did you know that?
Yeah.
That's what it is. And you can break it. It's your body. You can do it. So that's what we need to transition to. It's just good, healthy fats, grass-fed meats, fruits and vegetables. And you got all the carbohydrates that you need in these fruits and vegetables, especially the low-sugar fruits. Here's another thing that may make your life easy. It makes it easy for me, for breakfast, for lunch. After I work out in the morning, I'll have 2 scoops of this. It's got about 22 grams of protein in it, 5 grams of sugar, very low sugar. It's fruit sugar. And it's got all the multivitamins in there. So I'll have that, and I'll have it with berries, low-sugar fruit, and a tablespoon of almond butter. I know, Dr. Yachter, you talk about this at every workshop. Yes, the breakfast of champions. Yeah. But did you know that you can do it for lunch too? So today for lunch, I didn't have the fruit. It wasn't like a fruit smoothie. I made it with a sliced cucumber, an avocado, some lettuce. You could put kale in there, coconut milk. So now you got your good healthy fats, you got your greens, and you have an energizing green smoothie. So it's almost like having a salad. You have all your greens and all your vegetables, and you got your extra virgin olive oil, all your good healthy fats, except, you just did it with a shake instead. So it's very time effective, it's cost effective. You dump the 2 scoops in there, and that's it. It's all done. So that helps you keep your blood sugar stable, which helps keep inflammation down, and again, achieves the result that we're talking about. So we want to replace the bad fats with good fats. The hydrogenated, the partially hydrogenated oils, guys, you got to look out for this. Cottonseed oil, soybean oil, vegetable oil, any vegetable oils. It's not, I know the word vegetable may be confusing. Vegetable oil is either hydrogenated or partially hydrogenated. These are trans fats that cause inflammation. Rancid vegetable oils, margarine, synthetic butters. Please tell me everybody knows that. Margarine, synthetic butter, country crock. If that is in your refrigerator, take it out, throw it in the garbage. Don't even give it to your neighbor. You don't want to hurt them. Corn syrup, canola oil. Many of these oils found in breads, crackers, donuts, anything packaged, they put these oils in there for what? Shelf life. So the longer the shelf life, the shorter yours. Just remember that. The longer the shelf life, the shorter yours. I'm not kidding. You know, McDonald's French fries and a Big Mac, all the hydrogenated fats in there, guys. You can take it. Go on YouTube. Go on YouTube, and Google this thing on YouTube. The blowtorch versus the Twinkie. I used to show this video. It's still on there. And they take a blowtorch. What does a Twinkie have in it that I just talked about all in here? It's got what? Preservatives and hydrogenated fats, which are like synthetic motor oil. When you put synthetic motor oil in your engine, you can't kill the engine. It'll just keep going and going and going and going. So when you take a blowtorch to a Twinkie, it doesn't disintegrate. It's the same thing with a Big Mac and all these foods that we're putting in our body. It never even would occur to us that if you take a Big Mac and French fries and you put it in your garage or your porch and you leave it there for years, it does not disintegrate. It does not degenerate. Color stays the same, texture stays the same. Did you know that? Yeah, and that's what we're putting into our bodies. Even if you don't eat Big Macs and fries, any of the stuff that's in these foods, that's what's going inside of you, driving inflammation, driving your blood pressure, driving your blood sugar, and increasing your risk of cancer, because those are all highly, highly toxic. Is this making sense, guys? Yes. So we got to look at this. And now, one of the things that I said counteracts the inflammation is good, healthy fats. Extra virgin olive oil. That's why I'm not kidding when I say let your vegetables swim in it. Like if you're going home, you had green beans tonight or asparagus. I mean, literally, just don't measure it out. Let it just drizzle all over there. They should be swimming in it. There should be no fear of having too much of these good fats. They don't make you fat. They're not going to clog your arteries and give you a heart attack. It's junk science. It's a man-made fallacy. Good fats don't make you fat. They help you burn fat. And many of these saturated fats are vitally important for heart health, which you're going to learn in a minute as well. So what do you see here? Pure Irish butter, Kerrygold, yeah. Organic, so coconut oil, coconuts, almonds, walnuts, avocados, olive oil. These are all important things. Grass-fed meats. Make sure that you are getting grass-fed. When we grilled a couple days ago, that's what my wife got me. She got me a ribeye, and it was grass-fed, and that's what we put on the grill. You can have meat. I don't recommend having red meat all that often, but if you're going to have it, make a concerted effort to make sure that you have the grass-fed. If you don't, then you're having a meat that was fed with grain, which is highly inflammatory in your bloodstream. Okay, just remember that. So grass-fed is always best if you're going to have dairy. Eggs are good, the oils, the avocado oil. You need to have these good fats, which I'm going to explain to you why in just a minute. Saturated fat. How many of you guys are familiar with saturated fat? When you hear that word saturated fat, what's the first impression that you get? Is it good or is it bad? Bad. Wow. The overwhelming majority say it's bad. What is saturated fat? Why is it so bad? What does it do?
It hardens at room temperature.
It hardens at room temperature. Okay, so if it does that outside your body, it's probably doing it inside your body, right? Clogs the arteries. It's amazing. Like this is what we've been taught. So okay, so let's talk about saturated fat. Let's talk about the fats. Every cell in your body requires what? It comprises 50% of the cellular membrane. Remember, the cellular membrane is what has to be permeable to let the nutrients in and the toxins out, right? Heart muscle cells prefer what? Saturated fat for what? For fuel. How about that? Wow. How many of you guys want a healthy, strong heart that keeps beating and going and going and going? Well, what do you need? Saturated fat, yeah. In your lungs, what does saturated fat do? It creates surfactant so that the alveoli Say alveoli. Alveoli. Okay, that's plural for alveoli. Those are the tiny little air sacs that are able to expand. So the saturated fat makes the surfactant to allow your lungs to expand, thereby preventing things like asthma and breathing problems. If you're low on saturated fat, which they've told us to do, remember over the past few decades, asthma and allergies has increased by 400% in the last few decades. Did you know that? Another side effect of the low-fat diet. So we need that saturated fat. Your liver uses saturated fat to clear out fat and what? Bones require it to assimilate what? White blood cells of your immune system, and their ability to destroy germs and fight tumors depend on the fat in what? Butter and coconut oil. How about that? How many of you guys use coconut oil? Use butter? Awesome. How many of you guys are going to use more of it now? That's what I thought. Urban legend? I don't know. You tell me. There's a evaluation of 21 medical reports involving more than 340,000 people that they followed over a period of 5 to 23 years. Pretty good study. 340,000 people. The actual risk for coronary heart disease was 19% lower in the group consuming the what? The highest. Everybody say that word? Highest amount of saturated fat. 19% less chance of a heart attack. Intake of saturated fat was not associated with an increased risk of coronary heart disease, stroke, or cardiovascular disease. Again, published in the American Journal of Clinical Nutrition. So what does that tell you guys? We've been missing the boat. We've been missing out. We are not getting enough of these saturated fats. Your body needs it at a cellular level. You know, they're anti-inflammatory. It cuts to the very root and the cause of everything that we're talking about tonight. Tea time, tea. Studies in Japan show that drinking how many cups of tea? 5 to 6 cups of green tea a day reduces your risk of heart attack deaths by 26%, stroke deaths by an incredible 51%. Green tea, guys. Chinese study found that habitual green tea drinkers reduce the risk of developing hypertension by 46%. Catechin. This is an element found in green and white tea, reduces blood pressure, both systolic and diastolic, and improves insulin sensitivity within blood vessels. So what do we highly recommend? Green tea, yes. It's another heart healthy habit. All right, so let me talk to you about some of the supplements that we recommend for our Heart Smart Nutrition workshop. These are synergistic, which means when we use all three of these together, we get an amplified effect to get the clinical outcome that we need, which is important to reduce inflammation, stabilize blood pressure, reduce fat in the bloodstream, and help stabilize lipids in the bloodstream if there is atherogenesis. In other words, oxidation of the cholesterol, which could be becoming inflamed. If you do have this, if you are on medications, if you do have coronary artery disease, if you're a heart patient, your arteries probably are inflamed. And there's something called nitric oxide. How many of you know people that take the nitric pills? So what that does is it's a vasodilator, which means it opens up, it contracts the smooth muscle in the wall of the arteries to open up the artery. Now, there's something called L-arginine, which is a precursor to nitric oxide. And that's what this supplement has in it, copious amounts of the L-arginine, which is the precursor for nitric oxide, which will help to transition to this type of effect. So if you're a heart patient, this will help with that, and the overall outcome is helping to stabilize your blood pressure and improving blood flow to the heart. So that's why that's an important supplement. Another one is CoQ10. How many of you guys have heard of CoQ10? Again, if you're a heart patient, if you're taking a statin medication and your medical doctor has not recommended a CoQ10 supplement, they've missed something. Because it's well known that statin medications strip CoQ10, especially out of the heart muscle. And CoQ10 is a molecule necessary for all cellular function, in particular heart function. It's vitally important for heart function. So this is one of those things that is a must if you're on statin medications. Even if you're not, it's something that will contribute to heart health. And not all CoQ10 supplements are equal. This particular preparation that comes from Thorne it's not a dry powder. It's a liquid gel, and I've seen this because I was in the laboratory. It's the most purest bioavailable form, which makes it several times more absorbable and bioavailable for your body to utilize when it goes inside. Some of the other preparations, which is like, the crystals in the powder form, it goes in, but your body cannot utilize it, so you don't get the clinical outcome. So that's important to know also. But it enhances blood vessel function, enhances cardiac function overall, strengthens the heart muscle. And then last but not least, we'd like to call it a fish oil capsule, but this is a super high concentration of EPA with some DHA in it. And we know that concentrations of EPA, fish oil, actually help to target the lipids or the fat in your heart or in the blood vessels. So this particular Super EPA Pro lowers blood pressure, prevents arrhythmia, promotes the growth of new blood vessels, triglycerides, blood clots, counteracts inflammation. So a lot of bang for the buck with this one in particular. But as I said, with these, all three of these supplements, when you utilize them together, you get a clinical outcome which will help to get to the cause, the source, and the root of a lot of the heart problems that we suffer from, that we may be building or we may be medicated for. So that's why I recommend those. So that's why we have the supplement suite. The sale is only the night of the workshops. It's the only time that we ever discount our supplements. It's 20% off. For those of you who, I know a lot of you in here utilize the Mediclear. How many of you guys utilize you do the shakes? How many of you guys have done the shakes? Good. So for those of you guys who are always getting the shakes and all that, if you're getting all that, they're probably going to throw in a book. They're going to give you a free copy of my Born a Champion book when you get all that together. But again, this is the only time that we discount the supplements, and there's limited quantities. Anything else that you need to get is 10% off. But again, that's for tonight only. One of the other ways that you can get a discount on the supplements is doing a review online. How many of you guys read reviews online? I read reviews online all the time. And believe it or not, people read reviews before they come to this office. When they're looking for a chiropractor or a natural health practitioner, they read reviews. And guess which ones they go to? The ones with 1 or 2 star reviews, or the ones with all 5-star reviews? 5-star. All 5-star reviews, yeah. Would you agree that what you're learning here today is valuable? Yes? Would you agree that everybody should have an opportunity to hear this? Yes? Yes. So I have no problem incentivizing you to write a 5-star review. We give you 25% off any product or supplement if you be kind enough to do that. And we really appreciate that. That really goes a long way to helping a lot of people in our community. So just let us know. What you do is you do the review, take a screenshot, show it to them, and you got your discount. I don't know if you're aware of this or not, but we also have a technology that allows us to customize supplements for people, and it works with something called the Zyto scanner. You put your hand on the scanner, and the scanner actually reads your biological preferences at a different, organ level. Scans your body. It shows you what your body does best with which particular supplements. And the supplement recommendations that I gave you tonight with the supplement suite, those are more general. This is specific, and the nutritional recommendations we give you with this, as far as the supplements, are based on what the technology and the report tells us. So there's no guessing with this. The testing allows us to pinpoint exactly what your body needs. You have a flyer in your handout. If you're interested in doing that, look at the flyer, look at the phone number at the bottom, and then call that phone number. Her name is Allie. Allie works out of room 3 right over here. And if you call her, she'll make an appointment for you, and she'll get you set up for that, to get that scan for you. All right? Okay, so one more thing, one more element, which is very important. I will bet you did not know. Hey, don't do that.
GMA on call. Millions of Americans take medication to lower their blood pressure, but new research suggests there may be a better solution. The idea is that some people may be able to toss their pills and visit a chiropractor instead. So how would it work? And is this method right for everyone? 1 in 3 adults suffer from high blood pressure. Nobody can say for sure what makes it rise, but now a new medical study is cautiously suggesting an unusual way to bring it down. Realign the spine.
When the spine is misaligned, it can affect all types of things, all types of diseases, conditions.
The idea is that the C1 vertebra, located at the top of the spine, operates like a fuse box in the body. When twisted, it can pinch arteries and nerves at the base of the neck, not only causing discomfort, but affecting blood flow too. Denise Neiman suffered from neck pain.
Your upper body's off to the left 2 degrees, and
X-rays showed her C1 out of alignment. A special chiropractic adjustment lowered the pain and her blood pressure at the same time.
My blood pressure dropped tremendously.
Could there be a connection?
We designed a double-blind study to really look and see if, in fact, this procedure was affecting blood pressure.
25 patients got the special adjustment, 25 others a fake one. The ones who got the real thing saw their blood pressure drop an average of 17 points, a dip that usually takes 2 blood pressure medications to achieve.
So,
Significant. That's what he was saying, and that's the medical doctor. So again, it wasn't a chiropractor; it was a medical doctor that did the study. And so what it's telling us is that when we look at the neurological functioning in your body, somebody's getting a, what is that? Somebody getting an alert? Okay. So if you have a cell phone, if you'd be kind enough just to silence it, we're almost done. All right. So what that's telling us is that if vertebrae go out of alignment in your neck or your upper back, it doesn't matter how good you eat and how much you exercise. If you're shutting down the proper neurological control mechanism for your blood pressure or your heart, you're in for deep trouble. We've heard of Jim Fixx. This guy was an avid runner. He died out on a 16-mile run or something like that. We hear of people dropping dead on basketball courts and football fields, sudden cardiac death. Well, your heart rhythm is controlled by nerves. And all of that is under the control of your brain and your spinal cord. And your nervous system regulates your heart rate, your blood pressure, respiration, digestion, behavior, libido, temperature, appetite, sleep, metabolism. And it all depends on the messages making way from your brain down and out to the organs and back. And it all depends on how consistent and clear that communication is. Now, if you've got this going on, whether it's up here at the base of your skull or any other level of your spine, you don't necessarily feel that because only 6% of that nerve feels pain. What percent? 6%. So while those bones are shifting out of alignment, no different than a cavity in your tooth, you don't feel the decay process. And it's clamping down on the nerve, and it's like a kink in a garden hose, shutting down the communication from the brain to the organ. If it's going to the heart, what type of problem do you get? Heart problem. If it's going to your stomach, what type of problem do you get? Yeah, if it's going to your reproductive organs, what type of problem do you get? So it's not rocket science. In fact, guess what today? Guess besides Mrs. Dalen's birthday, guess who else is having a birthday today? Who's 122 years old? Chiropractic. On September 18th. I got you. You were following me. Very good. On September 18th, 1895, a deaf janitor walked into D.D. Palmer's office, and D.D. Palmer checked his spine. He noticed that there was a vertebrae out of alignment in his back. And he said, I don't know if this is causing your deafness or not, but this is not normal. And he pushed on the bone, and the bone made a clunk, and it went back into place. And Harvey Lillard got his hearing back over the next day or two. He had his hearing restored. So it was an accidental stumbling upon the neurological and structural relationship of a person's spine. And since then, there's been a lot of research and studies done. There's 60,000 chiropractors on the planet right now that take care of it. It's the largest natural healthcare profession in the world, and it deals with something so very simple. But we don't look at that. When we have health problems, we treat the effects with medications because that's the system that we use in this country. But there's not a drug in the world that can move a bone off a nerve. The weight of a dime on a spinal nerve will reduce the nerve transmission by as much as what? 60%. How much of this nerve transmission do you want getting to the organs at all times? 100%. What's the only way to know? It's to get your spine checked every once in a blue moon. If you're not getting your spine regularly checked to prevent problems, chances are you're probably developing them. So relative to what we're talking about tonight with heart problems, these are the particular areas, like blood supply to the head. If you've got interference at that level, That'll cause headaches, high blood pressure, tiredness, dizziness. At this level, it'll cause functional heart conditions, chest pains. At this level, it will interfere with circulation in your legs, sciatica, weakness. Regardless of whatever level it is, symptoms or no symptoms, we have to make sure that the nerve channels are clear for you to be all that God created you to be and not 1% less. And the only way to know that is to do testing. How many of you guys go for a mammogram or a prostate exam or an annual health physical or a checkup every year? Why do you do that? Because you don't know if you're going to have a heart attack in 10 minutes or if you're developing cancer, right? What do you need? You need tests. You don't know if you have a back problem. You don't know if you have a brain problem or a nerve problem. You have to have tests. So the testing that's the most scientifically advanced at this point right now that we have for the profession is thermography. So x-rays, the first professional to purchase an x-ray unit in this country, by the way, was a chiropractor. Did you know that? Yeah. So we still use x-rays today. It's very important because it's objective evidence. Now, if somebody comes in and they have a scan like this and there's red all over the place, that's a pretty good indication that there's a problem there, right? And if they have a thyroid issue, then it would make sense because that's where the nerves go to the thyroid. If they have painful irregular periods or sciatica or frequent urination, these are the nerves that go to those organs. That would make sense. And then we would take an x-ray, and if the spine is out of alignment right there, hello, we've got a pretty good causative factor or reason as to why that person has those health problems. Can a drug fix that? No. It can change the symptoms, but to correct the cause, source, and the root, you have to look at the circuit breaker, so to speak. Right or right? Yeah, so then once a person's under care, it's also important to clinically monitor and address that to make sure that if we aren't looking to fix it, that we can see the improvement. And a clear nerve system looks very different than an interfered one. And so that would be a good scan, and that would be a better corrected spine, and those are the tools that we use. So there are two reasons why we usually check people. People who come in with pain, sickness, symptoms, disease, and that would be a pretty good reason to have your nerve system checked. Things are malfunctioning, and they don't go away, they don't get better by themselves. But then the other type of person gets their spine checked and comes in because, it's kind of like going to a dentist. You want to prevent problems. It's a lot cheaper to go in for regular cleanings than it is to don't brush your teeth, and just keep going and getting root canals and cavities filled. Right or right? Yeah, so that's another good reason. Either way, from a preventative, proactive standpoint, which one saves all the time and the money? Getting it checked in advance. You can go for a mammogram or a prostate exam. By the time that finds cancer, it's what? It's too late. What if we do testing that shows pressure on the nerves going to your prostate, and now we can correct it before cancer has a chance to rear its ugly head? What is that worth? What is that worth? It's priceless, yeah. And that's the value of having your spine checked on a regular basis. Keeps you out of doctor's offices, off medication, and out of hospitals as much as possible. And that's not something that a medical doctor or a medical professional can do for you. Maybe 0.1% of any medical doctors that you know on the planet will do that. Their head is not oriented in that fashion. They don't get that type of training. But that's exactly what we do here. Half my family are medical doctors, to be honest with you. We don't argue about this stuff. They're just trained to do what they do. They like what they do. And I like what I do. I like not using medications. I like removing the interference so that the power that made your body can heal your body. You're a walking miracle. God doesn't make junk. Your heart's beating, your lungs are breathing. If you cut your skin or you break a bone, your body what? It heals. Your body was designed to heal. But the body doesn't need any help. It just needs no interference. And when we do the testing, it shows us where the points of interference are, whether you have pain, symptoms, sickness, or not. And so that's what I would recommend for you guys. If you are a guest here and you don't have a chiropractor, you have not had your nerve system checked in a very long time, I'm going to invite you to do that because normally it's several $100, $200, $300 to do an evaluation, a history, range of motion, the scans, the x-rays if they're necessary, several $100. But on behalf of the guest who brought you in, or the fact that you're sitting here tonight, we're going to offer that to you for only $40. Now, the $40 goes toward, that's a donation. 100% of that we give to Mission to 80, which we wholeheartedly support, and we continue to support. And, if you decide to take advantage of that, I can assure you that 100% of those funds will go to that. We were instrumental in helping to rebuild the structure that was destroyed in the earthquake in 2010. It provides for clothing, for schools, for the kids. So we're very deeply involved in that work, and that's why I do that. So I want to be a blessing to them, and I want to be a blessing to you. If you haven't had your spine and nerve system checked and you'd like to do that, the offer is good for today. The offer stands for today. The offer is good for you and every one of your family members as well. So if you'd like a voucher for any of your family members or any people who are not here tonight, you're welcome to extend that to them as well. Deborah, can you raise your hand? If you're a guest tonight, please see Deborah. She'll make your appointment. The offer is only good for tonight. The offer ends when I leave the building. But please, if you're serious about your health, I implore you to make that appointment, because you will see the value that lies behind that once you go through this process. So see Deborah before you leave tonight. And action steps. Make sure you get credit for tonight's workshop. See my staff at the front desk for the Heart Smart Nutrition supplements. And make sure, again, if you're a guest, make your way over to Deborah so that you get your nerve system appointment. And that's it. I ended almost on time, right? All right, thanks for coming, guys. Love and appreciate y'all. God bless.